if you think, the infraspinatus is limiting hand behind back movement. So either probably, you can do, dry needling, but I know, mostly people, they haven't done, dry needling. So they can use, some of the soft tissue techniques. You can do, some gentle and the deep, a massage. Alternatively, if you're dealing with the sporting, population, you can do, a digital ischemic pressure. So with the digital ischemic pressure, need to locate, the trigger points, and then you apply a bit of, a pressure. And it's got to be a firm pressure, and make sure, you maintain this pressure for good 30 or 40 seconds until you feel, the muscle is relaxing. It's a very good technique in 90-year-old lady with osteoporosis. No, I'm kidding. no.
Osteoporosis.
This is
On the trigger point, exactly.
This is painful if we apply.
Exactly. It's very painful, that's why I'm saying it's not, ideal technique for the 90 years old lady.
Or for any chronic pain as well?
And for any chronic pain as well, not with your patient as well, touching, the leg and having a lot of, pain. No. Okay,
I
now.
freaked out when I first saw it.
And I think you can't, let your patient know that you have got any psychological problem or sensitivity.
I just say, ask him questions.
Okay, now back stretches. So just on your back now. So you can do, some myofascial stretches of the tight, muscles. All you need to do, if you're doing, for the sternal head, taking up all slack of muscle, holding arm in this position, and then you're doing, the stretches. So it's not, the ideal sort of, a technique unless, you're working with the footballers. With me, I did, work in one of the sports medicine practice for 5.5 years here in Australia, and I was working with one of the football team. So holding it and then doing this sort of, thing.
So this technique can only be done with football players?
No, probably with the young and the healthy, people, if you have, because probably, if you're working in the musculoskeletal clinic, you'll get a lot of, sporting patients. Yeah? And if you're doing, for the clavicular head, make sure you palpate the muscle and then doing this sort of, thing. Okay. Cervical spine, thoracic, spine, probably, it's just, a separate area. You can do, hold relax for hand behind back movement as well. Is anybody familiar with the hold relax techniques?